Over the past weeks, we have taken strong measures to limit the spread of the coronavirus in the European Union. Certain national governments have introduced controls at internal borders, but we have 1.5 million people in the European Union who live in one country and work in another. They need to cross the border to go to work. Many of them have jobs that are important for us all to get through the crisis. And this is why today we are publishing practical advice to the national governments on mobile workers in the European Union. The aim is to ensure that these workers can reach their workplace without delays, while taking precautions to keep them safe and limit the spread of the virus. Member states should establish simple and fast procedures to ensure a smooth passage for them with proportionate health screening. It is particularly important that those working in sectors that are critical to fight the coronavirus can reach their workplace rapidly. These are the people working in the healthcare sector, in childcare, elderly care, firefighters and police officers, transport workers. We need our doctors, nurses and all health workers to be able to move rapidly from one country to another. For example, the vast majority of people working in hospitals in Luxembourg live in France or Belgium. The healthcare system in Luxembourg would suffer hugely if these workers were several hours late every day because of long waiting queues at the borders. And we need food in shops and on our dinner table. So we need those who produce it and deliver it to be able to move too. We need people to plant and harvest our crops. We have to make sure we have enough seasonal workers in the agriculture sector. They help our farmers, and they want to earn the bread for their loved ones at home. Of course, under safe working conditions. Many hard-working Europeans help us combat that virus. Together, we will make it easier for them to work safely.